not feel like it, but that means short season, and you might not be looking forward to that if you suffer from varicose veins.
Okay, joining us today, Dr. Alex Afshar. Thanks for being here.
Good afternoon.
From the Vein Institute. Welcome, welcome.
Thank you.
So let's start talk about varicose veins. Who gets them, and is it an age type thing? Do you get them at a certain age?
Not necessarily. The most common causes of varicose veins are genetics, number 1, 2 or more pregnancies, number 2, trauma, then going down the list with overweight, and then the age does play a role, but it's not one of the top reasons.
Okay.
So how do you get rid of these veins?
Well, it used to be a lot harder than it is now. Now it's mostly an in-office procedure with no downtime, no time of your feet. Fortunately, no pain except the local anesthesia that you receive.
Wow, and you could go back to work? You're not off your feet for a while?
Almost off the table.
No kidding.
Your restrictions are nothing more than compression stockings for a week or two, and walking 40 minutes a day, which helps everyone.
Yeah, does exercise help?
Absolutely. Walking helps a lot.
And where are you located?
We have offices in Fairfield, Westport, and Newtown.
Okay.
Some folks who might be watching wondering if maybe they can use insurance to help cover the cost of a procedure.
Absolutely. Most insurance companies cover them, including government health insurance companies like Medicare and Medicaid. They still cover the procedures because they are medically necessary. They are not cosmetic. The cosmetic part.
It's a big difference, yeah.
Yes, the cosmetic part of this disease is only about 10% of the disease.
Because the veins can hurt after a while. I mean, I'll be very honest with you, after my 2 pregnancies, I have them, and it's uncomfortable,
yes.
It's unsightly, and it's so great to hear that there are now easier options.
Absolutely. Now, this day and age, I mean, any kind of procedure you do, you also have to take aesthetics into consideration, and still treating varicose veins has one of the best aesthetic.
Doctor, explain to us what we're looking here. That seems like a severe case to me. You would know better, though.
Not at all.
Okay.
Not at all.
Okay.
This is probably falls in the middle of the disease. There are cases that are a lot more severe, including cases with ankle ulcers.
Okay.
And that is...
They disappeared. This is after how long?
That's a before and after, right?
Yeah, that in this case, that wasn't anything longer than a month.
Wow, that is really incredible.
Yeah, I mean, this is not an untypical scenario. This is pretty much what you get in hands of any good physician or surgeon.
And you said just a local anesthetic, so you're not really, there's no pain associated with this?
There is no pain except the pain for local anesthesia that it causes a little burning. But apart from that, most patients have no complaint at all. What I hear the most at the end of the procedures that I do is, wow, we are done, that was it.
Why did I wait so long?
Yeah.
What happens if you don't treat the veins?
Well, there are, the most common, the reason these are medically necessary is because they can you become prone to ankle ulcers, which means you have to go to a wound care center once a week. Gotcha. And the other reason is there is a small chance of a clot, and they obviously do get worse as it progresses because it's a chronic disease.
All right, well, we'll check it out then, Doctor. Thank you so much.
My pleasure.
Getting us ready for shorts and skirt season,
Yeah, I think
right?
a lot of people are going to consider this conversation pretty valuable. Thanks for being here. If you want to learn more, you can visit VeinInstituteCT.com.
All right, stay with us. More